Well, hello. This is Dr. GERARD CUOMO. I'm here with Ken at the Bisque Tryin phase. And so far, all's going well. We have adjusted out Ken's occlusion. We have looked at the porcelain. We looked at the surface of the porcelain. So we have some comments to make. This is Bisque. Let's go over occlusion first. Midline looks good, a little to the right, but that's about where the nasal palatine foramen and nerve is, so we're good there. We've checked his occlusion. We found that air on the mirror. We found that Ken has good contact. I'm going to adjust this a little bit from second molar bicuspid here and between number 6, 7. And of course, number 8 is hitting well too. So we need to have some porcelain added to this cusp tip in here, or possibly raise the occlusal table just a little bit on this tooth. All right. Seems like we're hitting pretty solid in here and in here. I'm going to re-tap him in place. Go ahead and tap together, Ken. Okay. And it does seem like he's hitting well in that spot. So bite down together, Ken. Okay, air on the mirror. So we have room to adjust, but we do want to add to either the central fossa, probably the central fossa of number 3. We'll fill that in. And open. We looked at the midline. We know that it snaps floss through the midline nicely, so that's good. We're going to check the other side now, the left side, and have you close down together. That's good. Tap together. Great. And open. And you can see now Ken is hitting here, here, and we don't want him on this ponic back here, but we need a little bit more contact on number 13. So I may end up relieving this area just a little bit more for him to have a little more freedom to go forward with his occlusion. As you notice, there's little blue markers underneath. That's the areas where we used a blue light-cure material to mark the ponics. Before I show you those, you just find out what that is. Okay. Before I show you those, we'll look at the arrangement. We know the surface could be much more smooth. We notice also we'd like to have a little more translucency up and around the lobes of the teeth, so we can have our lab add that. We notice that there are some little areas in between the teeth that some of them are filled in well and some of them aren't. Turn toward your right shoulder a little bit. In this area in between number 9 and 10, there's a little triangle here. We want this filled in as well as here. If we can do that from the lingual, that would be good. So again, some little odds and ends here. Or we can increase the width of this lateral and fill that in as well. And come center now. Okay. And we also notice that the corridor, the buccal corridor on the right side looks pretty good. We may end up changing the buccal corridor on his left side. So let's look at that right side. Close down all the way, Ken. Yeah. And then we look at this side. It just seems like it's a little toothy on this side. So maybe we can have our lab bring in the cusp tips on this side just a little bit. All right. Other than that, I think we'll have a very nice case coming up at his next appointment. Again, we're going to add some translucency to these teeth, and we'll get them to blend a little better with the lowers. We did want to have them come up a little bit lighter, but at this shade, but I think we're going to add some color, maybe some translucency in there. Lengthwise, we're going to measure that. Ken said that they felt like they were just a little long and that they touched his lower lip more than the temporaries that we started with. So if I look at the temporaries, of course, now these are two different abutments, but if we just kind of look at them a little bit, we can actually measure, but our measurement may have to go from this edge all the way to the tissue, and we'll do that at the end. So measuring now the edge position, we're going to come into some numbers. So this is tooth number 8, and we're going to measure it from the crest of the gum tissue right at the mid portion all the way to the edge, and we'll measure that. Number 8, approximately, it's about almost 13 millimeters from the incisal edge position to the gum tissue. It's very close, and it's almost identical to the other. So these two are roughly, I want to say, almost 13. Let's be very precise here. Okay. Well, I'm going to call it 12.5 on 8, and I'm going to call it a little longer. Let's see, right about there is good. Yeah, it's almost 13, like 12.9 for number 9, so 12.9. All right. I'll measure the cuspid, number 6, and that measures, that's like a 10.2 millimeters, 10.2, and the other cuspid, since these are the guardian teeth or the cornerstones, we're right up about 14.1. Alright, I might as well get the laterals, so let's measure this one. Alright, this lateral is about 12 millimeters. And turn to your left shoulder. That's it. And I'll measure the last one. This one's a little less. That's close to 12. Let's say 11.9. Okay, there you have it. Dr. Gerard Cuomo back with you again next time for the finish, and hopefully we'll have a really nice result. I'm sure we will. Okay, take care.